My name is Jonathan Jones, and it is my pleasure and privilege to be your host and moderator for the afternoon. Today is March the 16th, March the 16th, 2005. And it's a couple minutes after 5 o'clock p.m. Eastern Standard Time. And you know where you are, so you can just adjust the time according to where you are in the country. But thank you for joining us. Someone invited you here because they felt that there would be some value in discussions like this. Maybe you are an individual who's having problems with diabetes or high blood pressure, or you're wondering if your kidneys have anything to do with it. Maybe you don't have any problems at all with any organ or any part of your body. You're doing perfectly fine, but you want to keep it that way. And we're happy to be able to pass on information to you that could potentially benefit you. I can tell you personally, that's the reason why I have aligned myself and my organization, Healthcare Support Association of America, with Engage Global, because I believe that Dr. Prasad is onto something. I believe that the man has done something that literally can change the lives of every person who would dare to take a chance and listen and try his suggestions and his recommendation. He's forgotten more than most of us know. So that's who we're going to be having a discussion with today. So you can look forward to that in just a couple minutes. But we do need to kind of pass on to you some information that the government requires, because if you came here thinking that you were going to be hearing about something that's going to treat or cure disease, then you're in the wrong place, because the government does not allow us to make any claims like that. And we're not making claims like that. See, only the government can declare something to be a treatment or cure for disease. Therefore, the FDA has not, this is what we have to inform you of. The FDA has not evaluated these statements. Testimonials are anecdotal. That means that results are atypical. What happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives, host or co-host, are making claims that any of the supplements that we recommend will treat or cure any disease state. This presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. In fact, we strongly recommend that you seek the competent medical advice of professionals that you trust. So that out of the way, I'll tell you what I heard on a commercial one time: just because I can't say it, don't mean it, don't do it. So that's the only thing I'm going to add to that statement there. So that being the case, we're talking again about Kidney Awareness Month. That's where we are. This is National Kidney Health Awareness Month. I'm not sure that they put all those words in there or not, but anyway, you get the idea. But is it a real issue? Is it a real matter of concern? I can say that it struck my family personally. I've known about kidney problems for quite a long time. I didn't know the facts of it. I didn't know the connection, the causal association between kidneys, blood pressure, diabetes. I had no idea about that. My mom was type 2 diabetic, and eventually she no longer had the function of her kidneys, and she started doing dialysis. In fact, she was doing peritoneal dialysis. Another friend of mine also, he was HIV positive, in fact, and eventually lost the function of his kidneys. But diabetes is no joke. I saw what it ultimately did to my mom. She eventually started having complications from the dialysis, and eventually she started getting clots. Eventually she started having pulmonary embolisms, which led her to be in the hospital. And it was over and over and over again. And I still remember the words that the intensive care nurse said to me when I asked her what was she doing for my mom. My mom was in intensive care for few days. No, for about a week or so. Then they released her, sent her home. And then within hours, she was rushed by ambulance back to the hospital again. And that would be the last day my mom would be alive. And she says, the nurse said to me when I asked her what was she doing, she said, we're monitoring her very closely. And I thought, well, I'm doing that. I mean, I figured what are you doing? I mean, what are you doing to change her situation? And then the woman said the words that would change my entire life and my entire trajectory, my career path, everything. My background is computer electronics and engineering. She said, to be honest with you, we're praying for her immune system to kick in. I had no idea that the immune system was that significant. And with that, for the first time, didn't believe that my mother was not going to live and would not see the next day. I thought I knew she was going to die because had nothing to offer. And in fact, she did. She didn't. She died that very next day. We were in the middle of the night when the intensive care nurse said that. It was like 2 or 3 o'clock in the morning, and so she didn't make it because they didn't have an immune system kicker in her. And I decided I would never be in a situation again where I had nothing to offer someone who needed their immune system kicked in for whatever the reason, whatever the deficiency is. I would never be in that situation again. So I see the human body as a big computer, and that's the way I look at it. So I do research. I believe that there's a solution to every problem. All you have to do is look hard enough and find trusted sources. And that's where we are now. So as far as this kidney disease is concerned, chronic kidney disease, CKD, it affects more than 1 in 7 US adults. So that means about 37 million people. 37 million people have chronic kidney disease. And when it comes to diabetes and high blood pressure, those are the 2 most common risk factors. It's even higher. The risk factor is even higher for those who have those health issues. 1 in 3 people with diabetes and 1 in 5 people with high blood pressure have kidney disease. And here's the sobering part of it. 9 in 10 adults have chronic kidney disease and they don't even know it. So they called, I think, high blood pressure, they call it the silent killer. But I don't know. I think you can maybe trace that back a little bit further and say that it has to be CKD is the silent killer. 9 out of 10 people walking around and don't even know that they have chronic kidney disease. That's just mind-numbing to me. Early stage CKD often has no symptoms. Many people discover that they have it only when it's become a little bit more advanced. My sister had been suffering with stage 3 and eventually stage 4 kidney disease for many years. She began to develop the exact same health problems that our mother had, type 2 diabetes and everything else. My sister was eating as healthy as could be, so she thought. Everything diet like this and being very cautious about what she ate. But everything that she was eating, unfortunately, was causing inflammation and was putting some level of stress on her body and leading to the very same things that our mother had. Happy to say now that she no longer has kidney disease. She's doing great. In fact, this past year, she's lost somewhere in the area of 90 pounds. This is long before Dr. Prasad released his new GLP-1 boost formula. And I believe that she's extended her life by many, many, many years because of her choice to get her health under control. But kidney disease can worsen over time, eventually will lead to kidney failure, stroke, or a heart attack. It's just a matter of time. And that's what happened to my mom. She eventually, her heart stopped. That's just all that was to it. And again, it's very surprising to me that you can go to the hospital and be in intensive care and all they can do is sit around and pray. I'm a firm believer in the power of prayer, by the way. But then I had that covered with people who actually knew God's name. But that's all they were offering. They just sat there and watched, and it was nothing that I could do or anyone else my mother would not see the next day. So Kidney Awareness Month really kind of brings it to the fore for all of us to pay attention and to realize that there's a lot of people with end-stage kidney disease. So that's a whole nother category. So for those with chronic kidney disease, 2 in 1,000 are living with end-stage kidney disease, end-stage kidney disease, the kind that requires some level of treatment, kidney transplant, or dialysis. And Dr. Prasad has a great deal of expertise in this area. I'm just throwing out some of the facts that I dug up in my research on this. And I'm sure that he's going to be able to expand our understanding of this to a greater degree, not with the facts and the figures. Statistics is not, he doesn't need to be bogged down with that, but he'll tell us what we can do, what options there are for those that we care about with it. So nearly 808,000 people in the United States right now living with end-stage kidney disease. 808,000 people. 69% of them are on dialysis. 31% have received a kidney transplant. Men are 1.6 times more likely to develop it. And compared to white individuals, Blacks are 4 times more likely to develop end-stage kidney disease. Hispanic and Native Americans are more than twice as likely to develop it. So if you happen to be African American or Black on this call right now, then we should be perking up and listening carefully, taking some action, regardless of your ethnicity. You really should be taking note and be putting yourself in a position to take some action, one way or the other, when it comes to this dreaded condition. So I'm going to introduce to our discussion now and get some comments from Dr. Prasad, because that's why we have 110, now 120 people connections, 120 connections, because some of you have more than one person listening on your devices. And if you have not reached out to someone that you care about, I would encourage you to do so. Contact them now and get them here to this discussion, because what Dr. Prasad will share with us could be life-changing for them. You don't have to be in that situation where some nurse who, as well-intentioned as she may be, would say the words to you or to someone that you care about that we're praying for her immune system to kick in, and there's really not much else that we can offer. Get them on this call. If they've missed it and you don't think they're going to be able to get it, you can always find it on YouTube. And for those of you who are listening to us live on YouTube right now, thank you very much for joining us. Please like, subscribe, and share. You can copy the link to the page that you're on right now and share it on your Facebook pages, and send it to someone, and they can catch the full live stream right now. That's youtube.com/Jonathan Jones, youtube.com/Jonathan Jones. And that will get you to the live stream, or you can always share that link with someone. But Dr. Prasad was the professor at University of Colorado School of Medicine for more than 30 years, director of vitamin and cancer research. He was also a member of the Royal Society of Medicine, London, UK, and invited to be a member of the Nobel Peace Prize nominating committee for candidates in medicine. And there's a whole lot more here that's stated as far as his accolades are concerned, but just note a couple of them. He was the world's first radiation biology PhD. The Congress ponied up millions of dollars for Dr. Prasad to do research because they wanted soldiers on the battlefield to be able to remain healthy for longer periods of time in the most toxic environments on planet Earth. And Dr. Prasad, in the face of all the other vitamin companies in the entire United States, Dr. Prasad was the only one who stepped up to the front and said, I can do this. I can produce this formula that you guys are looking for. And it was so effective that it was awarded 8 or 9 patents. I think 7 or 8 patents on just that original formula alone. One of them, interestingly, included the words in the title, treatment for diabetes mellitus. So Dr. Prasad's formulas actually absolutely positively are unique, and they work. He's the author or co-author of some 33 books. I think it's more like 35 books now. He's been published nearly 300 times. And if you go to PubMed, which is the official library of all published medical documents, there's more than 450 references to Dr. Prasad's work. I did a search with AI once and just said, what's the top 10 best ways to treat a certain thing? And number 1 was food, change your diet. And number 2 was Dr. Prasad's formulas with having to do with antioxidants. I couldn't believe it. Even ChatGPT knew that this man was in the top of his class when it came to research, science, and micronutrients. There are no others who compare to Dr. Kedar Prasad. So, folks, it's my pleasure, my privilege to add to our discussion right now, and welcome, please, Dr. Kedar Prasad. Dr. Prasad, sir, we can't even, we repeat this sometimes, and sounds like a broken record to you, but let me tell you something. We really appreciate your presence and what you offer to us by the way of knowledge and sharing with us the things that you know and that you're aware of. So thank you for joining us today.
Thank you, Jonathan. I always enjoy with you and engage family. And I'm always willing to answer anything I can. on this disease. Today is kidney month, so I think we will focus on kidney.
Well, tell us. Tell us. Well,
So
you heard the statistics. That was all
yeah,
from the
statistic, it
CDC
is
and other
disturbing, and
places.
I was aware of most of the statistics because, as you know, this morning, 4:45, uh, I'm going to present through the Zoom call exactly on the topic of diabetes in Dubai.
Oh my.
And Dubai time would be 3:30. My time would be 4:40, 4:30 in the morning.
Oh my goodness.
So
So
I
okay,
have
you
to
can
get up.
practice on us now. Go ahead. Practice on us.
And so, but I have a slides and everything, but in any way, so it happens to be that I review those things on diabetes. And like you mentioned in your introductory remark, diabetes is one of the major causes of kidney disease. And and also second is the blood pressure. Also another one is not as important, but sometimes it becomes important, is infection. Sometimes
Mhm.
you get infected in kidney disease. And some of the early signs, because like you mentioned that many people are not aware of kidney disease. But what I read about it, that some of the early sign of beginning of a kidney problem is that frequent urination in the night, one. And second thing is that when you urinate, it forms foam. If they form a lot of
Okay.
foam, that is,
Okay. Yeah, that foamy urine. Okay, interesting.
yeah, I didn't know that. I mean, I was reviewing things that they claim. I don't know if it is really, but they say that it is possibility that these are some early sign. And if you get a test, and then keep an eye on EGFR, which is a function, creatine, for example, also function of kidney function. And so, and a higher the number, better it is. Lower the number, bad it is bad. So that many way you can kind of have some idea of what is going on. But major question is that all this disease that does it, what it does, why it causes those kidney disease. First, the major function of the kidney, as you know, is to clean up your all toxic chemical from the blood. So blood remain very nice and clean, and that they remove all the things, bad things metabolized through the urine. So that's one of the major function of kidney. But the thing is that I was looking into the literature of that again, just like diabetes, because it is increased oxidative stress and chronic inflammation is the major culprit of diabetes. And if the diabetes is not controlled, for example, all the diabetic medication that we take, oral medication or insulin, they treat the symptoms of the disease, not the cause of the disease. So
Mm-hmm.
none of the oral medication that you take reduces oxidative stress and inflammation. So what happens? One drug becomes resistant, the drug changes different drug, then they change a different drug. So there are 4 or 5 different medication, and they perform everything by different mechanisms so that glucose remain down. But again, nothing does which in him inhibit or reduces oxidative stress or inflammation. Not even one medication. So,
Wow.
my suggestion to people are there that first, for prevention point of view, it is important, like you mentioned, Jonathan, that you take a proper nutrient, proper diet, exercise, and so on. But see, when you recommend the diet and exercise, nobody follows it, even though it is a common sense to do it. But
Common sense.
but human behavior is tough to change. So, what is the best thing? You try to educate as much as possible, and hopefully, that some people will follow it at least to some extent. And so it is very important. Then second, what is the second best thing is to take a micronutrient, appropriate kind of well-tested micronutrient, which can reduce oxidative stress and inflammation. And they have as you know, we have tested all these things in our clinical study as well as in animal study, and they turn out to just a very good one. And so in this case, whether you are taking medication still it is okay to take this because then you will improve the effectiveness of medication. Doctor may like to reduce uh, and even the people who go in a later stage, like you mentioning, on a severe kidney disease,
Yeah.
at any stage of the kidney disease, you can intervene and reduce the rate of the progression. You cannot reverse completely back to your normal kidney, but at least block the progression so that you maintain a good quality of life while you are staying in this world. And so I think this is very important to remember. It is not just when you start. Any time in your life you can start. If you start before the disease starts, you will never get the disease. If you have a disease and have a medication, you will block the effectiveness, you will improve the effectiveness of the drug and further reduce the progression of the disease. So you will never go to uh, not only kidney disease, but eye disease, peripheral neuropathy, and all kind of diabetic-related complication occurs. So my advice to everybody is that at any stage of your life, you take a proper nutrient, of course, diet and exercise, knowing fully well that you will not follow it. And so this is, but anyway, sometimes I violate myself, So I think it is just one of those things that
It's a
uh,
fact. It
it,
is a fact, and I just hate to admit that that is the case where most people will not, for the most part, make their diet a priority, and all of us will fall off the wagon once in a while.
yeah, once in a while, but not every day, but no, once in a while, I follow diet reasonably well. And so I think it is very important that at least we have all these things available very easily. You don't have to worry about it. Just take a hydro or micro daily EMF capsule, your preference. And sometimes people don't like the taste of hydro, then you take capsule. And when you are taking capsule and you think you can swallow it, like I do, and I put a content in a yogurt and then take it. It is as good as hydro.
I
But
I have to agree with you on that one. I take it every day, at least twice a day,
mhm.
and I'm finding it to be extremely helpful. When I was in as a child, I always had problems with my kidneys or my bladder. But I have zero issues now since I learned to focus in on my immune system.
Yeah.
But when we look at this ingredients panel, Dr. Prasad, it really doesn't look like there's a whole lot unique here. Your combination is what's unique here, but you get added so many things here that is beneficial for the entire body, but especially the kidneys.
Yes, especially kidney oxidative stress. But you want to be not only reduce oxidative stress, but you should provide your brain, your kidney, all organs, and necessary B vitamin that they must have it. And
Mm-hmm.
so B vitamin has nothing to do with oxidative stress, but it is simply improving the function. And
Mm-hmm.
so I think in this scenario, as you know, um, recently I have examined many formulation that Beth sent me, and people are using those formulation, and you wouldn't believe it how bad they are.
Ooh,
And so I make my comment. If they're good, well, then I say it is some benefit, but most of them are just nothing.
wow.
It's so disturbing. But like places like different places like Montana and other people, all other kind of people, they're taking all this kind of junk vitamin that
Wow.
obviously the some people have reached them, and we have not been able to reach that. And I think Beth is trying to reach everybody, and so the question is, I'm sure that in all ethnic group, white or black or anybody, uh, until we reach them, they don't know. They take all kind of junk every day,
That's
and
right.
and one of the product I see on the television all the time is the XL Omega,
Oh yeah, Omega XL. Mm-hmm.
Omega or XL, yeah. And I said, okay, I might let's see what the ingredient of Omega XL is. And a doctor testified, the patient there said, looked like a real one. But I found that DHA, which is the most important component of omega 3, is 0.01.
Oh,
And
wow.
I have in our formulation, I don't know, I have probably 500 milligram.
Wow. So it's almost non-existent in this
Non-existent.
mega $1 million product.
Yeah.
Wow.
But see, in a commercial market, you can sell almost anything.
That's right.
But
That's right.
another sign that's very interesting, half an hour in business channel, in a Bloomberg channel, I watch quite a bit. And so they half an hour devoted purely on GLP-1, how great it is. It is great, but they never mention toxicity. They mention all the good stuff.
Yep.
See what I mean?
Unbelievable. Yes, I do.
Yeah, and so
Yes,
the
I do.
people,
Ozempic, you're
I mean,
talking about.
Ozempic, for example, is a good example. I mean, many
Hmm.
people have lost weight with Ozempic, and there's no question about it.
Right.
But it has serious acute side effect, and also late adverse effect because they have been there for market for some time. Because initially, as you know, they were FDA recommended for diabetes,
Hmm.
but all the commercial advertisement, you don't see any of those things.
Hmm.
And our product that we have developed, which has also GLP, not only GLP-1, but also GIP. And so the question is, thus far I have not heard any toxicity issue, acute toxicity from anybody. Maybe Jeff is here. He can expand further because he gets all kind of email from people. But anyway, so back to the kidney function. So I think if you keep your body at a markedly reduced level of oxidative stress, because as you grow older, if you don't take all this kind of good diet or any even good diet, if you take it,
That's
still
right.
you have a low level, but still you will have oxidative stress. And so if you want to prevent and have a good quality of life and no kidney problem or any other organ problem, then you have to adopt earlier the program that we have developed, namely,
That's it. That's it.
at least two is a must, two is a must one.
Yeah,
One is the micro daily, either capsule or hydro, or a probiotics. These two
that's
are
it.
must.
That's it. That's
And,
it. I tell you what, Dr. Prasad, um, I have an example of a woman, Ms. Olive, who had end-stage kidney disease. And
mhm.
I'd never met this woman before, and to this
I
day.
like to hear, yeah.
But her daughter, Corrine, interrupted our call one night and said that she wanted to tell a story about her mom because she was blown away by the results. All she did was give her mom 5 capsules of your product, Microdaily EMF, while her mom was in end-stage kidney disease
Hmm.
and on the verge of dialyzing, and she was not producing any urine at all. So they
Hmm.
had put in a Foley and everything. So we've got that recording, and we want to share that with you
Yes, yes, love to.
because there's a bunch of people on here now. A minute ago, I told you it was 120, but now we're up to almost 150 connections. And some of those have 2, 3, and 4 people at their
Mhm.
location. So you got quite a few people. Many of them have never heard Miss Olive's story. We do
Mhm.
have Coraline that's on the call now, and I'm sure she can give us an update on what ultimately happened with Ms. Olive. So I'm going to share that now.
Mhm.
And as folks are listening, remember the disclaimer that we read earlier that testimonials are purely anecdotal. What happens to one person may or may not happen to you. But we're just sharing a firsthand story of a woman who talked about her mom, and she's excited. She was in this, what to me, it struck home with me again because it was like what happened to my mom. It's like I felt like, here's somebody should be able to do something, and Corrine had an immune system kicker in her, and it worked. I just wish I'd had that earlier. So,
Hmm.
so too bad you was too busy with the army at the time that I needed your immune system kicker in her. So hang on one second here with diabetes, and his brother-in-law's story is just amazing.
All right.
It's amazing. So
Can I talk real quickly? I have to run. Is it all right?
your name, please.
My name is Green.
Okay, Kareem.
All right, so I just have to say it. So I started, I've been pre-diabetic, and I started the entire supplement last Friday, and my blood sugar been running like 115. Now, since I start using it, it's been like 88. Anyway, I'm not even here to talk about me. So my mom, I'm a nurse, and my mom been in the
Wait.
hospital. Friday morning. Congestive heart failure. She's also diabetic. And she has chronic kidney stage 4. So she has all this fluid on her. They put her in MSICU, and she's been having a lot of problems. I was scared to death as a nurse, thinking I'm going to lose my mom. Difficulty breathing, her lungs filled with fluid and all that. Anyway, I said, I want to try it. I want to try it on her. But then I'm like, oh my God, should I not? So I went to the hospital and I mixed 4 capsules of the Micro Daily in the applesauce, and I gave it to her yesterday morning. Now, she wasn't peeing. They're thinking diabetes. They're thinking dialysis because her kidney functions are way, way off. I'm like, oh my God, I can't give her dialysis. Now, I kid you not, within 5 hours of me giving that to my mom, now they had put a Foley in her because they want to see if the urine output was coming. They're like, we don't see urine, maybe she's retaining. Now, within 5 hours, that urine, that bag had 800 liters of urine in it. I kid you not. Now, then her hemoglobin was a bit low. So the nurse said, is she anemic? Yeah, she is. So they said, and they kind of tugged the Foley a little bit. So there was a little bit of blood. So they did a hemoglobin to see what her blood count was. Now, with the bleeding, her blood count should be lower. Her blood count went up by 2 points. 2 points. I kid you not. Then, my mom, she's been sleeping ever since I put her in the hospital, sleeping. She would open her eyes and go right back into a deep sleep. When I went back to her yesterday, she was up singing. All last night, she was peeing like rain. All right, in the Foley catheter. I went back this morning because she's in MSICU now, and they're saying, hey, they're asking me, is she full code? Yes, she's full code. All right. I went back this morning and I gave her another dose. The cardiologist, they called me and they said she might go home Tuesday. So the nurse, they did a urine culture. They were like, oh, we gave her some antibiotic just to make sure. But she just turned around, a full U-turn back to okay. So we think it's a dose of antibiotic that did it. But I did not tell them what I did because I wasn't supposed to do it. And I'm a nurse and I work at that hospital. So I couldn't tell them. But
Right.
My God, I just had to say it. I am driving now to go give her another dose. And I just had to say it because I tried it so I could introduce it to my patients. But when I see what it did to my mom that I thought I was going to lose, I'm like, oh my God. So
Karen, that's
my
wonderful.
story. I don't even want to talk about me right now. I'll talk about me another time. But this just helped my mom. Her kidney function, her BUN and creatinine started going up to the normal level. It's not there yet. It's going up, going in the right direction. Her blood glucose, because when they check it, it was 244. When they check it, it was 118 again. Oh my God.
How old is your mom, Karen?
87.
Wow.
87. And now, nice clear urine coming out. That wasn't coming before. They were setting up dialysis for her. The doctors is like, oh my God, okay, she's doing very well. We don't know. The nurse is thinking it's the antibiotic. It was not the antibiotic.
Antibiotic is amazing. Yeah, just amazing.
It was the Micro Daily that did it.
Which formula did you give your mom? EMF or original?
Yeah, the red label.
And you gave her four capsules?
I gave her 4. Yes.
Okay.
Karen, your story will undoubtedly help a lot of people because
oh my God. I am a nurse. I'm almost a nurse practitioner. And I was a bit hesitant to give it to her. But I'm like, you know what? They're telling me my mom is doing very bad. I'm just going to take my chances. Oh my God. My mom sang a whole hymn this evening to me. It was doing for me, but I was a bit, especially with her age, and she has a lot of stuff going on: congestive heart failure, diabetes, hypertension. She had a heart attack before, she had a stroke before, a whole lot. And oh my God.
So Dr. Prasad,
I just had to say that.
Kareem was out of breath relating that story, and she just couldn't
I mean,
look at the
but
excitement that she
if you
had.
look at that, her oxidative stress was so high in her
Mhm.
body than any and the way they were giving it like in a apple sauce, it gets quickly absorbed and did the magic. I would say that's a magic. Theoretically, I would not have accepted it. I mean, accepted it.
She's a nurse, and so we're listening to a professional relate the story about her
Yeah,
own mother.
nuts. Yeah, yeah.
So this is not just some Johnny come lately or Susie around the corner
No,
telling a
no.
story.
And she was corrected not to tell anybody because she was working, they might get fired for her.
Yeah, yeah, and we got it on blast now, so I don't think it's ever traced back to her. Corleen, are you here?
I'm here, Jonathan.
Well,
Caroline,
Hey, Dr. Prasad, how are you?
Caroline.
Wow.
this is one of your
That's an amazing story.
amazing stories here with Miss Olive. What can you share with us?
You know, when we first heard Miss Olive on your call, Catrice did some research and she said she's on our team. So we reached out and we started talking to them. And Miss Olive, they sent Miss Olive home and told her she would be dead in 3 days. And there was nothing else they could do. And that was it. And Kareem was just so determined that she continued to share that product with her mom. And I mean, she became a favorite of the company, if you really think about it.
Oh yeah.
Everybody was sharing, her story. And Miss Olive, I mean, she would come on, you guys, she would sing to us. Dr. Prasad had a chance to meet her, via Zoom. And Miss Olive lived 19 more months, you guys, because of this product. 19 months. And unfortunately, her daughter had a caregiver and she was at her home, and I don't know exactly what happened, but she fell out of her bed. She hit her head. She went to the hospital. And even with that, we called Dr. Prasad, and Dr. Prasad talked to the hospital pharmacist, and they agreed to the micro daily. Dr. Prasad wanted them to give brain boost, and they would not agree to the brain boost. I forgot why. They said it was an ingredient, and they wouldn't agree to it. And because the interesting part, Jonathan, you did a piece on how sometimes the color variation was different. So all of the product that I had was that bright orange, because sometimes our brain boost is that pale color. So she couldn't sneak it into the feeding tubes like she had done before. But if she had not had that fall, she was planning to go on a family cruise. They had T-shirts made and everything. Miss Olive was just amazing. So, when I heard you say that, it like kind of brought up some emotion, because I said, wow. But thank you, Dr. Prasad, for all you do.
Yeah.
Thank you for the update, Corleen. We need to hear that, and we need to know this stuff is real. It's changing lives.
Right.
19 months, but let me just say one more thing, John. Just 19 months.
I would have given anything to have 19 more months with my mom. So that's
19
all
months
I can
of
tell
quality, though.
Yeah.
She wasn't laying in the bed. She was out functioning. She was going places with her family. She had 19 more months of quality life because of these micro daily products.
At 87.
Yes, so we did a birthday for her for 87. We did 88, and I guess this would have been 89th, because her birthday would have been May 31st. So yeah, she was just, I mean, and we used to send her little gifts, Jonathan. So like on her day, we sent her a box of like 87 $1 bills, and she's like, oh my God. I mean, where she was just excited. You guys, I'm telling you, 19 more months of quality life. You can't, that's priceless. You can't buy that.
At that age, yes.
Yeah.
No.
So
No,
thank you again.
She was
I would
younger
give
than me.
everything. Everything I
Yes.
have, I would give to get my
Yes.
mom back for 19 more months. So no
Yeah.
question about it.
Yes.
Yeah,
That's beautiful.
me too.
Well, Dr. Prasad, for anyone who cares about a family member
Yeah.
and wants to have a chance, is it taking a chance, Dr. Prasad, for them
No,
to
there is no downside. That's the thing. It's not, there's no, the worst thing would be there is no effect, but there is no downside that it will aggravate the disease.
Mhm.
That's one good thing about our product is that there is no adverse reaction. In other words, in all cases, it has been always positive, but sometimes I always say that, well, the worst thing happened, it has no effect. You
Right.
know?
That's right. That's right. Well, that's good. Well, there was one question that came up earlier when we were talking about the foamy urine. Um, Hayden asked the question, is foamy urine and bubbly urine, is that pretty much the same thing?
Yeah, bubbly, same, yeah, about same thing, yeah.
So if it starts to get bubbly, but foamy is pretty dramatic when you see the foamy urine, right?
Yeah, yeah, you
It's
have
like
to
a
heat
foam.
not just a small one, have a small amount. You have to have a large area of the urine, the cover.
A large area you can
Yeah.
see right there in the toilet or
Not in a
wherever.
small area
That's really
where you're
foamy.
just peeing it and then accumulating.
Bubbles is one thing, but
No.
foam is a whole different story.
Yeah. foam is
Okay.
different.
All right. So that may not, Hayden, that may not necessarily be the case, but look for foaminess, and that may tell something. Jeff, do you have? Can you relate the other situation where you had that was not just in stage kidney disease, but this person had already reached the point of dialyzing? Can you
Yes.
tell us
Yes,
about that situation, please?
I can, and I apologize. I haven't followed up with William here lately. I promised to do that, but yeah, let me just share William's experience, and he goes on a little bit talking about the significance of commitment to the product, how long he was on it. You've just described some dramatic, really short-term benefits, but William talks about in the like 200 plus days worth of commitment to supporting his body through nutrition. And so yeah, let me just share William's experience here with everybody. Sorry, I should have had it ready to go. I was thinking this would be a perfect time to share it, but let me just here we go.
On a micro daily January the 8th this year, 2023. And I have had a great experience so far. I had high blood pressure, which was so high, that's what knocked my kidneys out. And I really hadn't gotten really any relief from the high blood pressure. And until I got these macrodated products into my body. So it's been 229 days since I've been taking the product. And I have seen some great benefits in my body. I have, in 2009, I had a car accident, got hit in the back and gave me whiplash, and my right and left hand, pointer fingers and thumb went numb. In 3 months, the left finger and thumb came back to life, but the right finger and thumb stayed numb from 2009 to 2023 when I got on the macrodated product. So I know it was macrodated that stopped that numbness. And one evening, my finger and my thumb was just like electricity was going through it. And I just hit my hand on the bed trying to stop that pain. But that next morning when I woke up, there was no numbness in my finger and right thumb at all. So we had cleared that up. And the blood pressure has been up and down a little bit, but everything else has been great. And when I was in college at 18 years old, I hurt my knee real bad. And now since I've been taking the micronutrient products, that knee is now just totally like I never have damaged it at all before. And I didn't do any surgery or anything, just taking these products. So it's been a blessing to me in a lot of ways in my life and with different things. And one thing about my back, I never have ever had a back injury to my knowledge or anything in any way. But I noticed since I've been taking these micronutrient products, I feel as though I'm getting total hydration because my back feels just really relaxed and really at ease. And it's real smooth feeling now, just like something something great has happened. So those are some of the things I realized what was going on in my life. And also, I haven't urinated in over a year and 3 months or so because of the kidney failure. But today, I had a different type of urge to urinate. I have had urges before, but it wasn't the same feeling I had today. It wasn't even in the same place. It was just different. But anyway, those two urges I had today, I was able to urinate for the first time in a year and 3 months, twice.
Wow.
It wasn't much, but it's starting. So I just I guess the arteries and the veins and getting ready to start to unplug. So it's taken a little while, but 228 days, but look how long it took me to get to this place and mess my body up, but it's coming together now. So I think it's great, and I just keep looking to see what advancements I'll be receiving as I continue to take the product. So I pray to all of you all, if you start on the products, give it time to do what it's supposed to do, because minerals and vitamins do not work like pharmaceuticals that give you a fast benefit, but it's never healing. The microdata might work a little slower, but it is healing your body. So stay with it, but do get started. God bless you.
Thank you.
Pretty
Wow.
amazing. Yeah, pretty amazing, Jonathan.
Wow.
I'll pass it back over to you, but earlier you had a conversation about, priceless, that extra time with your mom. Well, imagine somebody here
Wow.
already committed for over a year, almost a year and a half of not urinating at all, having a dialysis take all of that out. I mean, basically 3 times a week, down to where his kidneys are coming back online. So talk about some hope for
Wow.
many.
That's incredible. Jeff, thank you very much for sharing that additional story. It fits right in with our subject matter. So, for those of you who are wondering what is the magic that Dr. Prasad just made reference to, well, this is it. This is what we recommend, and this is what Dr. Prasad recommends. The core four. We haven't talked much about the GLP-1 on this call, because this has not been the focus of this discussion. But this coming Tuesday night, there will be a discussion about collagen and the GLP-1 boost, and because there's a whole new bundle, core four, GLP-1 core four, that you'll learn about. But this is what has been the component that made all the difference in the world for most people. So if you just focus on the micro daily, that's great. Dr. Prasad says, as the very minimum, go with a probiotic. In addition to that, if you need extra help with digestion, you can do that. There's the brain boost that Corleen talked about. You need some help with sleep, we got that too. Have some problems with anxiety, we've got that also. And omega and collagen, as you can see on the screen. So the cost, if you were to buy each item individually, would be $310. If you tried to buy the ingredients, I think it would be closer to $1,000. But Dr. Prasad put the formula together so it's in the right combination and the right quality, and from the right sources in the right form. And Engage Global subsidizes this, so you can actually get it for less than $200. This entire bundle. If that's a little bit outside your price range, no problem. Go with the minimum that Dr. Prasad recommended. The basic bundle. That's just the micro daily and the probiotic boost. You can get that for half the price. So you don't have to be left out. You can still do something to improve your kidney health. And as you can see from the last gentleman's story that Jeff shared with us, he believes that his body began to respond from being on Dr. Prasad's formulas. And it took him a while. And he gave the reason. He said, gave you the rationale. He said, it's one thing to take a pharmaceutical drug that often will work quickly. He said, but you got to be patient when it comes to nutritional supplements. So I would suggest even doubling up on it. Dr. Prasad has said that's okay in acute cases as well. So these are the bundles. As you can see, these are the main bundles without the GLP-1 boost. You'll learn about that this Tuesday night. So whoever invited you to this discussion today, make sure you get back with them, have a conversation with that person, and they'll give you the guidance that you need on which bundles to choose, which formulas you need to take, and help you to get it for the best prices. And that's the whole key to it, because you can never overdose on this, but we don't want you to overspend. So we do want you to get it for the most reasonable prices that you can. So talk with the person who invited you. And one last thing we recommend before we make way for a couple of final comments from Dr. Prasad is do for yourself what you can. This is Kidney Awareness Month, National Kidney Awareness Month, but we recommend that you get moving. Change your relationship with your couch. Start walking. If you can get in 7,000 steps a day and alter your diet, select better, higher quality foods. The more green, leafy, raw vegetables that you can eat, the better. There's no question about it. So find organic if you can find it, and try to eat as healthy as you possibly can, because what you put in your body will make all the difference in the results that you get overall. We had one person who she was fighting on, and this is kind of interesting, Dr. Prasad. I just had a conversation with this woman a couple of days ago. She's from Central America. And we gave her recommendations to get started on high doses of antioxidants, high doses, triple doses of micro daily, because she had kind of a nasty cancer. But her niece asked the question. She says, "Well, what can we do to change your diet?" And usually, I don't take people sad, but I don't take people very seriously sometimes when they're asking about changing their diet. But they persisted, Dr. Prasad, insisted, and said, what can I do? What can my aunt do? She wants to change her diet. So we sent her over a diet based on something that Dr. Brian Clemens had put together. We studied this years ago. And so we sent that over to her. And wound up talking with her again about four weeks or so later. She sent a copy of her CAT scan and radiology reports. And it said that the tumor had not grown. In fact, it was shrinking, and lesions on her liver was starting to heal. And I said, well, how much of the microdaily are you taking? Well, we haven't gotten started on that yet. All she did was change her diet, Dr. Prasad. She hadn't even gotten started on your formula yet. Already seeing positive benefits. So listen, folks, Dr. Prasad has been telling us, change your diet. Improve the quality of your food. It can make a difference. So you can do for yourself, along with Dr. Prasad's formula, and you be amazed at the results. So Dr. Prasad, any final words here on this National Kidney Month, the month of March?
Just do it like suggested. You suggested diet, some exercise, at least walking. And still I walk 2,500 steps. My wife walks 6,000, but in my age, I can't do 6,000. But I control my diet and so on, and of course I take all product. Another thing I wanted to mention: sometimes under these kind of health condition, serious health condition, people get worried about anxiety, depressions, and so on.
Oh yes.
And so for that, we recommend CBD. Only 100 milligram we can take CBD, and it is very important because CBD will increase the serotonin level, which calms you down. Serotonin prevents the glutamate release and therefore toxicity, and which makes you hyperactive and full of anxiety. And there are many FDA-approved drugs available for that. To inhibit glutamate secretion or to increase the serotonin level, but those have also toxicity. and CBD has no toxicity and does exactly the same thing to calm you down, make you happy.
That can only help. Lower stress levels, it can only help.
Yeah. Well, if you have it, many times people
That's
may
right.
not have it.
That's right. That's right. Well, Dr. Prasad, thank you. Thank you very much again. We look forward to having discussions with you. Dr. Prasad will be back next week if his circumstances will allow for it. Corleen, thank you for sharing your story. Jeff, thank you for sharing your story. Horace,
Jeff?
thank you for being a fine co-host.